My name is Heun, I'm a consultant psychiatrist and editor of Global Psychiatry Archives. I'd like to talk about vascular dementia. It's the second most common type of dementia after Alzheimer's disease. It happens in 20%, and it's caused by a little emboli or effects of chronic hypertension in the brain. And usually in vascular dementia, you have a sudden onset, a stepwise deterioration, fluctuations of symptoms, and usually the history of cardiovascular risk factors. There are three more typical syndromes. One is the cognitive deficits after a severe stroke, very often with motor dysfunction and paresis. Then sometimes you have cognitive deficits or deficits of the executive functions, but you very rarely have just memory problems. You might have a type which, or one might have a type which is of multiple strokes, where the symptoms can vary much more and they can be much more difficult to detect, but vascular risk factors are more common in this case. Then you have another common type of vascular dementia, which is progressive small vessel disease, also called Binswanger disease. And this type of dementia very often affects the general slowing, the intellect, and sometimes memory. You can have pseudobulbar palsy, which affects the muscles in the lower face and the muscle of the tongue, which affect the language. And depression can happen in these cases as well. Thanks for your interest and have a nice day.